This podcast is produced by OnPod, a video content studio near you.
Hi, everybody. Welcome back to the podcast. Today, we are here with Dr. Cheryl Netterfield from POMMe-Health, a platform to connect healthcare teams and better serve patients. Thank you so much for being here with us today.
And thank you so much for inviting me.
Of course, yeah. So, what inspired you to create a tool designed to help healthcare teams work together and improve patients' everyday lives?
Okay, well, a little bit about my background.
Mhm.
I worked with the military for 25 years, and we dealt with a lot of very complicated situations. So you can imagine bringing soldiers that were injured back home from overseas and the coordination of that. It involves a lot of different people, a lot of different healthcare providers, a lot of different administrators and non healthcare providers. And a lot of the times, if we're not communicating very well, things can get confusing, inefficient, mixed up, and there's gaps. So that was sort of my first experience dealing with really difficult situations and perhaps the starting point for my platform.
Okay,
Yeah.
yeah. I could see how there's a lot of different institutions involved and how
Yeah.
you'd have to get the paperwork for everything and connect that. And then also the stress of having these injured soldiers coming in. I'm sure that's like emotionally draining as well, correct?
Yeah. Well, it's important to take care of people who've been injured and such, sacrificing themselves. And some of the injuries were very significant, obviously. So you want to ensure that they're given the best delivery of healthcare possible. But it's the coordination of all these efforts that is really hard. Whenever you get together a team, they're all from different studies, different professions, different experiences, and they don't all talk the same language. So they all speak very differently. They've all trained differently. How do you come up with a common language for everybody? And that's really hard to do.
Right,
Yeah.
right. And you were also a family doctor. So how did that experience shape your ideas for this platform as
Mhm,
well?
mhm. Well, I was a family doctor through the entire time that I was in the military and still am practicing. A family physician sort of knows a little bit about everything. We have to manage everything from sort of birth till death. And I think that that was one of the key reasons why this idea came to me. Also, unique to being a family physician in the military is that we learn about occupational medicine, disability medicine, return to work medicine, different types of work related, very specific work related medicine. And you're always thinking about how can I get this person to their best level of functioning to do what they need to do in whatever role they're in, whether it's flying a plane, diving, digging a trench, whatever that might be. There's a lot of different applications. And being a family physician, especially in the military, really gives you that perspective and you become very in tune with that and think about that all the time. And that's sort of the basis of the whole platform, to tell you the truth. Yeah.
Right. Yeah, that
Yeah.
makes total sense. Like everybody has a different job and
Yeah.
also everybody's affected or hurt in a different way as well, like different body parts, like
Hmm.
optometrists, gynecologists.
Everybody.
Uh,
And also too, at the time that I was involved with bringing injured soldiers back home from Afghanistan, I was in Winnipeg at the time. I was in a position called the wing surgeon. So I was the lead clinician of that clinic. And we would have discussions around a round table. We'd call them rounds or case conferences. And my job was to facilitate that meeting with all the different care providers and come up with a good plan.
mhm.
And I recognized back then, especially now with what I know, there's a lot of things that I didn't know at that time. I left the meeting with a long set of notes that I had an administrative assistant and scribe take down, but I didn't always know what I didn't know. There was a lot of hidden parts, a lot of gaps there.
Right. Yes.
Yeah.
So there's like a lot of management in
Oh
that.
my goodness. Yeah. A huge amount. Yeah. And everybody, um, I trust to know their own role, their own interventions. I'm not telling people how to do their job. I expect them to be professionals and do it. But how do you coordinate it for the good of the patient
Hmm.
and not add more stress to the team? Because there's a lot of stress on the team from not being able to coordinate efficiently.
Right. Yeah. So because different doctors and specialists don't always communicate well, how does your platform help teams share important information and work together more smoothly?
Mhm. It's all about the common language. So think about now, when I talk about an interdisciplinary team, I'm talking about healthcare professionals like the doctors, the nurses, the pharmacists, but I'm also talking about allied healthcare professionals and non clinical people. So, for example, We could add on the personal care worker, the pharmacist who's a professional but works typically outside of the group. There are occupational therapists, physiotherapists, speech pathologists, like every single type of person who sees that patient needs to be involved. Also, there's the patient and the family. They're not healthcare providers, but they should have an opportunity to say something too.
Mhm.
So, what we've done with the platform POMMe-Health is we've actually created customized checklists for each patient based on the functional outcomes that are important to them. Now, I'll give you an example of what a functional outcome might be. For a person who's had a stroke, it would be really important to know how well they can get dressed, how they can feed themselves, and if they can get to the toilet on their own. That's functioning.
Mhm.
To me, it doesn't matter if they have a headache or a pain in their elbow. I want to know if they can do the other things.
Mhm.
So, up until this point, we frequently look at symptoms and not functioning. For somebody with a mental health illness, are they functioning by getting to work on time? Are they being able to take care of their health well on their own? And are they getting along with other people? Those are great functional metrics.
Mm.
And most people present with a little mix of physical and mental health. So we make a checklist that's unique for them. And everybody on that team, including the patient and the family, will input their perception of how that person is functioning. Everybody on the team, including the patient and the family. So now you have consensus perspective on person's functioning. And that's how we speak this common language.
Right. So this is why it's important for patients and families to be part of the conversation about their care.
Exactly. Yeah.
Okay.
Their perception is very important. And what's interesting is true collaboration comes from when there is a different perspective shared, but you don't know why.
Mm.
So if everybody has the same perspective, then you can move on quickly. Everybody agrees. But when you don't agree or you don't see the same perspective, that opens the dialogue for collaboration. And that's actually the really interesting part. I like it when people don't agree because then we have something to talk about.
Mm.
If you don't know you don't agree, then you can't talk about it.
Right.
So you have to find it. It has to be uncovered.
This reminds me of like when you have a pain somewhere and then you go to the doctor and the doctor's asking you, okay, where does it hurt? And then all of a sudden it doesn't hurt anymore. That kind of eliminates that problem because you get a day-to-day synopsis of what exactly is going on. And then your family member can say, actually, they were limping
It
here.
hurt yesterday and the day before and the day before. Yeah. So you get perspectives. And I believe, regardless of what kind of training they have, everybody has eyes and ears, including the patient, including the family, including the person's boss.
Mhm.
They all have eyes and ears. So these inputs are all valuable and they're all relevant for the care of the patient. They don't dictate if you do surgery or if you do a prescription or you give somebody manual therapy for something. But what it does, it assesses where that patient's going, and then you can track it and monitor it over time.
Do you find that it's easy for like a new doctor on the team? So, like, say someone has to go to physiotherapy and they have POMMe-Health. Do you find that it's easy for that physiotherapist to look into it and start to integrate themselves into that platform? Like, how are other doctors responding?
Okay. So typically, POMMe-Health would be utilized in a setting where there's already a healthcare team set up.
Okay.
Now, people think that that might be a very common thing, but it's actually not as common as it should be. In the hospital, if you look at a specific ward where somebody's staying, especially a rehab ward or where somebody's had surgery, there's an interdisciplinary team there. And a lot of these groups will typically meet once a week around a table and talk about it. It is facilitated by somebody. That is a prime example of where this works. Out in the community, it does exist. Unfortunately, it's not well managed, coordinated, and it's not as present as we would like it to be. Coordinating outpatient care for people in the community is really, really hard, and that's where all the big gaps are. So there are teams where there might be a case manager, whether it be a nurse or an occupational therapist or social worker, leading the team. And then the doctor would be part of that team, but the doctor might not necessarily lead it.
Mm.
The physiotherapist would be part of the team, but they're all entering their little scores. And then hopefully they have the opportunity to meet or talk about the patient. That is the scenario that we're sort of testing things under right now before we branch off into other more independent kind of work so that other people can use that on their own.
Right. Okay. And technically, when you have all this information in one place, people
Mhm.
can start to see it virtually too,
Mhm.
connect the dots, right?
Yeah, exactly.
Okay.
So the interesting thing is we have electronic medical records. And it is a place where information is stored, but it doesn't really think very well.
Mm.
When all the information is stored, it is stored in the language of the person entering it. So you have progress notes. Progress notes are things that people type out or click on little buttons, and it's in the language that they're familiar with. So if I look at my progress notes, I'll understand them. But if somebody else looks at mine, they may not understand them. If I read somebody else's, I may not understand theirs. So how do we share perspectives quickly rather than having to read the entire chart, which still doesn't mean we're going to understand what the other person has written down. So we've codified it using a standard language that involves a numerical score, and it gives everybody the same language. Doesn't matter what background they're from. It doesn't matter who they are. And then this can be represented in a tabular format, in graph format, and gives you real life data to look at in a very quick manner.
Nice, yeah. So there's graphs right there, and there's codes, so you can go in, or
Yeah.
legends, kind of. It's
Yeah, and it
legend.
doesn't take, it's like a checklist. I call it a checklist, and it doesn't take long to fill out. I'm very, very conscious of the amount of time it takes to provide healthcare and the administrative burden for everybody.
Mhm.
Nobody wants more paperwork.
Right.
So this has been created to be extremely fast, very efficient, and give a high return on the amount of time that was invested into it. The investment comes back with more efficient meetings, prediction of issues that arise, a very fair way of prioritizing functional issues. And then it leads to something called a standardized collaborative care plan. Now, collaborative care plan, you can think about it any way you want. Somebody's taking notes in a meeting or they're filling out some kind of document. I have found in my travels doing this, and especially, when I was more involved doing collaborative care, that a collaborative care process was not taught to any of us. We don't know how to do them. We do them very poorly. And this is part of the reason why the ball gets dropped a lot. I can't find great collaborative care processes out there. They are not currently part of an electronic medical record. And without doing a really robust collaborative care plan, there are a lot of risks with missing pieces of information. So this is what I'm really fascinated about too, is that how can we mitigate risk and make sure we're doing everything we can for somebody?
Right. Yeah, that makes sense. Like you'd almost need it to be like a course or have like a more open mind. But like you said, everybody's has limited time, and there's a lot of patients that everybody has to get through. So,
Yeah, and many places that I've talked to and watched and followed and worked with, they all do it differently.
mm,
And would I say that I've seen some good ones? Yes, but I've seen some really bad ones too. And that kind of puts my guard up a little bit, that I'm concerned about the level of care that somebody would be getting when things seem to be, I would say, very disorganized on the other end.
right.
Yeah,
Okay.
yeah.
Now, because everybody's health situation is different,
Mm-hmm.
how does POMMe-Health customize care plans to fit each patient, what they need, and what they want?
Sure. So the customized care plan currently, because of my background, I'm doing it manually. And what we'd like to do is digitalize it so that I can onboard people quicker.
Hmm.
Thank goodness for AI and lots of different tools that we have today. It's based on what the person is presenting with. So if they've had a stroke and they have depression, that would be geared around, that would be the starting place. It's also based on what they can do at the moment. We're also looking at environmental factors. Where do they live? Do they live by themselves? We're not looking just at the patient, we're looking at their environment, their home, their family, their community. So I look at this as a true biopsychosocial model,
Hmm.
which is also something that tends to be forgotten when we're trying to discharge a patient from the hospital.
Right.
We discharge a patient, we know that they can walk, they can go to the bathroom, they can eat, but the wheelchair ramp wasn't installed, or one of their family members is sick and can't help them. Those are huge factors.
Mhm.
And so we inadvertently, not purposefully, discharge them too soon, and then they either decompensate at home, they don't get better, and then they're back in the hospital right away.
Right.
So readmissions are common. Things need to be really well prepared from a support perspective to get people home properly.
Hmm. It's like an episode of Host, but for everybody. You go in, you see their environment, you check around what's going on.
Well, and the thing is that most of the patients in society are at home. They're not in a hospital. They're not in a care facility. Most people are at home.
Hmm.
The bulk of our healthcare expenditures, or a lot of it, I don't know the percentage of it, is in the hospital because it's expensive.
Right.
A hospital stay expensive. Most of your very expensive care machines, the specialists are all there. Cost a lot of money. but most people are at home.
Mhm.
So, relatively speaking, there's not enough care and coordination and money allocated to really organize care at home really well. We could save a lot of money by doing it better.
Yeah, that
Yeah,
makes a lot of sense. It's
yeah,
like proactive instead of reactive, right?
yeah,
Okay.
yeah, exactly.
Yeah. Can you share a story where this kind of personalized care really made a difference for a patient?
Okay, well, I am a family physician, but I currently do psychotherapy now. So, as a family physician in Ontario, this is something that we can treat patients for. I developed a checklist for my patient, and we were following the functional outcomes. I think the checklist was probably, let's say, 20 items long. And this patient decided that they were on a medication, but were offered a second one and thought that, maybe medication A is not working that great. So she switched to medication B and we tracked her functional outcomes. And within a 3-week time period, we saw that a number of the items on her functioning, like work performance, sleeping, mood, went down significantly. Within a very short time period, she was able to see on the graph that was produced that medication A was probably still the better one. Now that's just her filling it out on her own, without my input, without anybody else in her circle, but just alone on that perspective. Within 3 weeks, we were able to recommend back to her family doctor to go back to medication A again. That's a really quick turnaround. Now, if you're looking at a patient from 10 perspectives, because you have 8 care providers, the patient and the family, you get a lot more information. So that's really exciting. We're at the stage right now that we're looking into getting into larger teams and doing this on the digital platform to continue to get feedback on the efficiency of the platform. But I'm really excited now to start looking into feedback on the graphic displays. It's a really exciting area to test different displays to see how they assist people making decisions. And so that's the next step of our journey.
Yeah, I really love that because if you do start a medication, it's very easy to just go off day by day and like say, oh, okay, 3 days later, I kind of feel like crap. Like maybe it's not working, maybe it is. But when you consistently fill things out, I think that's where, the data actually comes in. And when you can see it on a graph, I feel like maybe a lot of people aren't mathematical, but they are visual. So it's nice to see that kind of end result, which is great for the patient.
And the other thing too is I'm not looking at symptoms.
Right.
So symptoms are I have a headache, I'm nauseous, but there are people who have a headache that can go to work and other people who have a headache who can't work.
Hmm.
There are people who might feel nauseous that can do something. We can't define ourselves, first of all, by the disease we have and also by the symptoms we have. It's more important to see how are we functioning and getting on in life. And the goal is for everybody to be as independent as possible to the best of their ability.
Yeah, for
And we can bring in people's goals to this too.
Yeah, for sure. Okay, so let's go back to the pilot programs that you're
Mhm,
starting with your healthcare teams or healthcare teams in general. What successes have you seen so far, and what are the gaps that you're seeing as well?
mhm, mhm. Successes so far are more awareness
Mhm.
from everybody on the team. I would say the most awareness, the most benefit is from the facilitator because the facilitator now has more information to plan and project with. I think a sense of ease or peace or maybe more calmness or awareness is really nice. I'm very interested in the culture of collaborative teams and making sure that they're working together better.
Mhm.
As we start this out, I find that when teams first use this, they're all thinking about this from a different perspective. It takes them a little while to sort of learn how to use it together as a group,
Mhm.
and then they kind of meld, which is kind of nice. This is a new process, actually. This is a new process that um, healthcare teams aren't doing today.
Mhm.
We're fortunate to have things like digital healthcare platforms that allows us to be done manually. It takes too long. It would not be possible manually. So thank goodness for digital innovations that we can do this much quicker.
Mhm.
Um, I'm finding that there's little gaps with the educational aspect of how to use the platform. There's not a steep learning curve, but through trial and error, I learn where I may have not explained things well enough. So, with every new process, you learn along the way.
Mhm.
Um, Honestly, it's been really interesting. It hasn't been anything discouraging or serious anyway. There's no major stumbling blocks per se. It's all about getting more information to make it better, and everything's been really positive.
Mhm.
So nothing shockingly negative. There's not been anything, you know, bad or deterring in any way.
Yeah, for a new
Yeah,
product, all feedback is good feedback, and
exactly. Yeah,
collaboration has
yeah.
huge payoffs in the long run in any project you do, whether it be healthcare or business or anything. So I could see how, this is going to be a really good
It,
turnaround
it's
for a lot
it's
of people.
funny when you talk to teams. It's like, okay, tell me everything you hate about them. They go, what do you mean? I says, yeah, I want to know everything you don't like because I want to make it as easy to use and as simple as possible. If they love it and we call it, if they're delighted by it, then they're going to want to use it.
Hmm.
If it's hard to use, if it's not intuitive, it's not going to be enjoyable.
Yeah, it has to make sense to them for sure.
Yeah, I take this everywhere I go now. When I'm on a website or a platform that doesn't work properly, I go, ah, this is a terrible experience, terrible user experience. And what do I know? I mean, having said that, you learn through building something yourself as to how things should work and what makes them enjoyable.
No, it's true. Like you said, with any kind of resistance, it's going to make people want to use it less. It's
Hmm.
like a habit. If it's not right there, you're not going to do it. Yeah.
Hmm.
So, for doctors or healthcare workers interested in tools like yours, what
Hmm.
advice would you give for introducing the new technology in busy and complex healthcare environments?
Hmm. Hmm. Well, it's up to me to find the right team to start using this with. If I approach the wrong team, it wouldn't be fair to them because it might be hard to adopt. The process that needs to be set up ahead of time is selecting the right interdisciplinary group, which means they do have a facilitator. So if something like this came along and you didn't have a facilitator, it would be difficult. That's up to me to say to them, it works best under this circumstance.
Hmm.
That doesn't mean they go out and get a facilitator because that could mean a change in their normal routine. Um, and then I have found that um, I try to fit in with their regular clinical processes that I'm already fully aware of. When a new company is coming along and they have a digital innovation, it's not going to work perfect right off the bat. It does take time. I wish that healthcare in general could allow more time to providers and remunerate them for now testing out new things because they need time to do it, but it's almost like they have to do it on their own time. So it feels rushed. It may not feel um, worthwhile for them, especially if it doesn't work, and you have to allow for that. You know, we're everybody is too busy to just give away their time for free. So I think that that is something. It's not to the healthcare providers. I would say it's more to the administrators and the payees to actually find a system that supports remunerating your clinicians and teams for working with new digital health innovations so that you give them the time to try them out and give them the feedback.
Yeah, because I feel like in a business setting, you would have HR saying you have to learn this program so that it saves us in the long run. But in a medical team, like there's not
Yeah.
always that
Well,
going
think about it. In an HR setting, this is a great analogy.
on.
When you give a training package to a new employee, they read it on company time.
Hmm.
They get paid for it. How does trying out new digital innovations fit into a clinician's schedule when they're not given time to do it? And theoretically, they're not getting paid for it.
Hmm.
So, how do they try it out? It has to be built into it. Now, there's a couple of different models out there. There's fee for service. They're not getting paid for any of this. That's really difficult. And then when they're salaried positions, it could be a little bit different. But given the current situation with the lack of resources, there's always patients waiting. So there's really never enough time. So we don't have a really good scenario set up right now for these kind of things to be fit in and tried in a relaxing way, in an enjoyable educational manner where there's lots of feedback. We don't have that environment right now.
Hmm.
So it's very difficult for these things to get off the ground and be tried.
Now, what do you think it it would have to take to change that? Do you think it would have to take like regulations, Ontario regulations? How could we fit that in or
Hmm.
kind of
Hmm.
bridge this gap?
Yeah, no, I've been thinking about it recently because I've been involved in a number of different programs and the same issues keep on coming up. It's not regulations per se, but what it would be is that the payees have to recognize that this is an important, uh, these are important projects to engage in, but it requires time and people should be honored for the time that they're giving, including the healthcare team.
Okay.
So it is now being squeezed into their regular day it takes away from their day, they feel more pressured. If there was some alleviation of that and they were allowed to participate without the burden of other things bothering them. I felt very blessed in the military because I worked as a salaried physician. So when I was on a training course, I left. I didn't think about what was at home because we had coverage, and a lot of the care provider scenarios right now don't have that.
Mhm.
There's not enough around right now to do what they need to do, let alone backfilling or providing coverage. So the system's just overwhelmed right now.
Right. So each team is going to have to approach this in a different way and kind of learn about it at their own pace. And if it makes sense for them, then,
Yeah.
they'll have to figure out how
Yeah,
to.
it's all about change management and learning, and that's really difficult to introduce into an industry where they're completely overwhelmed, and the last thing they want to do is learn something new.
Right.
Yeah.
Okay. So
Yeah.
if someone were to want to learn a little bit more about POMMe-Health or how they could get involved with their team to do more with it, where could they find more information?
Well, I mean, we have a website, so that's the easiest place. We have contact information on there.
Mhm.
POMME, POMME stands for Patient Outcome Management and Measurement. So that's where that came from. Um, I'm on LinkedIn. Love it when people reach out to me and to talk to me about the platform.
Yeah, for sure.
Yeah. And I don't stalk people. I just politely follow them and then meet them
Yeah.
and strike up a conversation and say, what are you interested in? What are your concerns? What are your worries?
Mhm. And those are all great things that people usually like to be asked because everybody has problems. And it's great to have someone come in and, there's a platform that you have that you want people to be more educated on, and people have problems that they would like to solve. So I think it's a great mesh to go.
Yeah, there's so many things in healthcare to be solved right now. There will not be any stagnation of new ways to help healthcare deliver better health,
Mhm.
but also with providing some benefit back to the healthcare providers also.
Yeah. Well, thank you so much for being here.
Oh, you're
I
very
feel,
welcome.
yeah, I feel like there's definitely a lot we have to do in healthcare, and thank you so much for being one of the people that are helping us solve it.
And thanks for letting me share my passion project with you.
So I'm gonna look more into it. I'm very excited.
Thank you.